Tonight, two of the biggest stories in the world right now collide. Discussions about race and COVID-19.
Well, anyone can catch the virus, but here in Washington and across the U.S., minority groups are disproportionately affected by COVID-19. Mayor Kawash shows us why this is happening.
Well, the evidence is right here in Washington. Our Hispanic community makes up just about 13% of our entire state population. But as you see there, 40% of the 22,000 people who have tested positive in Washington are Hispanic. Now, our African-American community makes up 4% of the state population, but you'll see there, about 7% of confirmed cases. This is something that's happening nationwide.
Now more than ever, we're seeing the importance of equality for all people in the U.S. That applies to this pandemic, too. For months now, people from our Hispanic and Black communities have been catching COVID-19 more than any other race.
In our community and across the nation, that we know those folks tend to be people of color, low income, and based on where you live.
In Michigan, Black people make up 14% of the state's population, but they account for 33% of cases in the state. More of the same in Louisiana. Black people make up 46% of that state's population, but also 70% of COVID-19 deaths in the state. It's not like the virus is choosing to infect these people, so how is it happening?
And they're in processing plants. There are agricultural workers that are paying the price for us.
A higher percentage of minorities are essential workers. They don't have the luxury of working from home. Some ethnic communities also don't have the same access or resources to health care. Spokane Regional Health says those communities are lacking PPE gear.
We have to support communities in creating their own healthcare systems. It's access to care. It's one of the quadruple aims.
Health officials say there may be some money under the CARES Act to provide PPE gear to those minority groups. Dr. Lutz also took the time to call for change all across the U.S. when it comes to equality.
The structural racism that exists, it underlies so much of what we do in public health. And if we don't address it, we're doing ourselves and everybody that we serve a injustice.
Now, it's worth noting Dr. Bob Lutz was at the protest Sunday with hundreds, maybe even thousands of people for George Floyd. He says the race issue in our country is also a public health emergency. Live in studio tonight, I'm Maher Kawash, 4 News Now.